Hubbard-Robinson. This is Millennium Health Matters Radio Show. I'm your host, and really elated this morning. We've got two fantastic guests with us. One you've heard from in the previous months and years, and a new friend and colleague and partner with Millennium Collaborative Care. I'm glad to have them both on with us today. But before we get into that, I just want to say good morning. I think spring has finally sprung. We're on our way. I think we're on our way. It has been so frigid, a frigid winter, but we have so much to be grateful for and so much to be thankful for. And I hope you are thinking about your wellness and how you need to get up every day, get a walk in, get your glass of water in, and you know, it's all about your heart and the blood pumping through your arteries so that you can have wellness and enjoy a great life. And on the subject of wellness, we've got two fantastic guests with us, as I said. Victor Ilozue, he's the COO at Rapha Wellness Center. And we also have Jocelyn Guthrie, who you've met before. She's the fitness instructor at the Rapha Wellness Center. We're just so glad to have you both with us this morning. Good morning.
Good morning.
So, you know, as we traditionally do, we'd like to have you tell us a little bit about yourself and why you love Buffalo so much. And we're glad to start with Jocelyn, and then we'll hear a little bit from Victor, because she's done this a few times before.
Well, yes, my name is Jocelyn Guthrie. I am with Rapha Family Wellness Center as a master diabetes prevention trainer, certified personal trainer, and a lifestyle coach. So it's great to be here this morning. It's an honor, as always, to be with Rita and my partner. Not in crime yet. I haven't converted him quite yet. But nevertheless, it's a pleasure being here. I enjoy being in Buffalo because it's on a rise. And definitely we have seen the vision that we spoke about over years ago actually come to pass now. So that's the pleasure of being here.
People want to be well. Yes. They want to have wellness in their lives. And I want to thank you, Jocelyn, for being a leader in this area. You've been for free out there encouraging people to be well and to move their bodies, and we really appreciate that. I know in the summer you're going to be doing your walks at the park.
Yes.
So we're going to have you back and talk about that. But in the meantime, we're here to talk about Rapha Wellness Center, and our COO of Rapha Wellness is Victor Ilozue, and he is here today. And we're just so glad to have you, and I'm sure you'll be a fixture on the show as well, because you guys are doing some wonderful things that are really leaders in medicine now, and how medicine and wellness can cohabitate in a way to improve the lives of others. So why don't you tell us a little bit about yourself, your background, and why you love Buffalo?
My name is Victor Ilozue. I've been in Buffalo for about 16 years. You know, I work for Rapha Wellness Center, and I really love, wellness, holistic wellness. Originally, I have a background in IT. I've been in IT for such a long time, but I'm now back to wellness. Actually, I was drawn into wellness, by my wife.
Yes.
She started, Rapha, Wellness Center because of her passion to get people well. And
why don't you tell us her name?
Dr. Frances Ilozue.
Yes.
She really, so passionate about getting patients well.
Yes.
And she was having so much challenges,
yes,
getting them well. So she decided to start the wellness center to try to help the patient out. Hopefully we're going to be talking more about that,
yes,
through the program.
Yes. And she has connected, originally she started with a medical practice, correct? And she has a medical practice, but this is a wellness center that is promoting the wellness side of medicine.
Yes, she has a medical practice, and what was happening, when she sees a patient, okay, by the time the patient will get back again, they have added more, more weight.
Yeah.
So she was so troubled about that and looking for a way to try to, control, the weight gain. So, and then she started the wellness center.
Yes. So, Victor, tell us a little bit about where you're from. You're obviously not originally from Buffalo. So just tell us a little bit about that. I'm sure the listening audience is intrigued.
Actually, I always make a joke that I'm from, New Jersey.
France.
Because I've lived in New Jersey for so many years before coming to Buffalo. Okay, so, but originally I am from Nigeria. And I went to school at Rutgers, New Jersey, before coming to Buffalo.
All right. Well, we're glad to have you here with us today, and I know you love Buffalo because you guys have made roots here, and you're so passionate about the work that you're doing, and we want to talk a little bit about that today. You mentioned that your wife, Dr. Ilozue, is passionate about the wellness of our community, and she's looked at the sort of medical needs of the community, and this is not enough. So why don't you tell us a little bit about the mission of the Wellness Center and how we are where we are today.
Okay, our mission really is about holistic wellness, to get people well, because when people really are, when you talk about holistic wellness, you're talking about mind and body and the spirit.
That's right.
Okay, so those three are critically very important. And change of habit. We are not talking about dieting here. We are talking about change of habit, and it takes a while to change people to start thinking the right way, to start eating the right thing. Mainly our major focus now is on diabetes prevention. Because with diabetes it can cause so many issues in the body. It puts people, too many risks of cancer, risk of, heart disease, risk of, COPD, and you can keep going down and, down the list. So if we're able to prevent, diabetes, if we're able to control obesity, it's going to go a long way in making people, well.
And living longer.
Exactly.
And not losing any limbs, because we know the prevalence of diabetes in our community really is causing limb loss, blindness, as you said, heart disease, and other comorbidities. And this is a disease that can be prevented in most cases. And certainly we know that there are genetic factors, but most of the factors, and even if you have genetic factors, you can reduce the risks around those genetic factors if you focus on the things that you can control, right? So we're just so excited that the Wellness Center is really honing in on weight loss and eating habits and like a whole lifestyle, a whole living lifestyle, movement. We've got our fitness instructor here with us today. So we're really, really excited at Millennium that the Rapha Wellness Center is focusing and drilling down to what we call root causes of poor health. So we're really excited. Why don't you share with us, one of you, share with us the actual components of the diabetes prevention program and how you have come to put this together.
So the components of diabetes prevention, actually it was a program that came out of the CDC, Center of Disease Control, and it's a year program. So basically for the first 6 months, you have to complete 16 courses, 16 classes, and that's split up in half an hour of lecture and a half an hour of physical activity. However, physical activity is important, the lecture is important as well, but we're doing more on the physical side with our clientele. And then for the remaining six months, then it's just basically maintenance to make sure that we're meeting at least once a month to make sure you haven't backslid or you're doing things that we taught you. But what I'm learning in this class and what we have learned so far is that it's 3 components that we focus on. And it's the behavior modification, nutrition, physical activity. All 3 of those go hand in hand, because if you cannot, I say behavior modification because I think of the mind. If you do not make that change in your mind, then nothing else will follow.
Interesting you say that. They say that the biggest muscle that you have to get under control
is your brain.
when making a change is the one over your shoulders,
yes,
right?
And it's so funny because the head is at the top and then everything follows downward. So that is what we're focusing on right now. Actually, we do have orientation coming up, which we present what actually takes place in that course. And that will be taking place on this upcoming Thursday, the 14th of March, from 5:30 to 6:30 p.m. And if you have Medicare or Blue Cross Blue Shield, then is a billable service. We can bill your insurance, and then if it's not that, then it's a charge, and the charge is $450 for the entire year. Include with that, not only do you get the lecture and the lecture and the exercise during the allotted time that we're seeing you, you also have times to come in to work out during the week when the facility is open. So it's not like we just seeing you that one time a week. We're also allowing you to come in throughout the week to exercise as well.
Okay, so you have an orientation about the diabetes
prevention
program
and the other services that we're offering. We also are having a health fair April 17th. And mammogram bus will be there. It will be, if you still want the flu shot, podiatrist services, basic checkup, overall checkup, and things of that nature. So that will take place from April 17th from 9 a.m. to 4:30 p.m. So if you haven't had your mammogram, you can get your mammogram done there. If you need your feet checked, you can have that done there. If you want to speak to a doctor just to ask, we are there, nurses are there, I'm there, and we can give you an overall preview of what we actually are offering at the Wellness Center.
So let me break some of these things down before you start talking, Victor. So we were talking about the diabetes prevention program, and if you're interested in the diabetes prevention program that Rapha offers, so we're going to talk even more about the elements of that today. So you're going to get like a pre-orientation on this morning, but you actually are going to have a physical experience if you come down to the Rapha Wellness Center on this coming Thursday, March 14th, from 5:30 to 6:30, and you'll be able to meet Jocelyn, Victor, Dr. Ilozue, and other nurses and professionals that are at that location. Could you tell me the address?
The address is 3610 Main Street, and I always say the University Plaza, but actually, I shouldn't say this, but Dunkin' Donuts.
Between Dunkin'
and
Donuts
Domino's. So I don't know what is taking place here. I want to go out there with a stand with fruits and smoothies, and I don't know what's going on. We're gonna have to get a health. We may have to in our parking lot, or get like a farmer's market going on there to balance that out a little bit. But nevertheless, that's when the orientation will take place.
So if you're familiar with Buffalo, you know where Dunkin' Donuts is. It's at the corner of Main and Bailey, and a little bit south of that location is the Rapha Wellness Center, which is right before Domino's, right?
Yes.
Which is perfect. It's like, okay, what should I do? I need to go to the Wellness Center. Okay, right. Don't look left, don't look right, just go straight. And then you talked about another wellness day that you're going to have. And is this wellness day just for your your patients?
No, it's open to the community. Public? It's open to the community. It's open to the public. Anyone can come in, and we'll be able to serve you at that time.
And I imagine you'll be able to find out more information about the diabetes program and other things that you have to offer, not just the mammo coach and other things that you were mentioning.
Well, let me backtrack on that. It's for the patients only. So you have to be a patient.
All right, thank you, Victor.
The patient.
Yes.
He like.
So that makes sense, and the reason why I say that is because I know my background is with that mammo coach. Had a little something to do with it, and you need a prescription in order to use the coach. So that's an incentive. So I'm going to make a plug for you, Victor, and that is that if you don't have a primary care provider, Dr. Ilozue is a fine provider. And you can become part of the Wellness Center and its mission by becoming a patient with Dr. Ilozue. And you can, I'm sure, Victor, you have a phone number. We'll make sure we give that phone number before the end of the show for anyone who's interested in all of these important aspects to your health, because it's not just enough for you to just get a flu shot every year. There are other components to your health that we've talked about on the show. It certainly is an important component to see your primary provider, but it's the daily things that happen in your day. And this practice is concerned about all of those things, and not just coming in for your annual exam. There are so many things that are happening in our community. Access to food, access to wellness really isn't as as easy to get in our neighborhoods, but it can be if you're a part of this practice. So before we go, Victor, if you could share that phone number.
Okay. Before then, I just want to say a few more things
Sure.
about the diabetes prevention. It doesn't really matter where you are, what insurance that you have. Okay, so far you have a Medicare. Okay, you can attend the program. Okay, because what CMS is actually, they understand that about 1/3 of America, are at risk, of obesity, and if nothing is done, they are going to end up, having diabetes. So they are really putting a lot of emphasis and trying to prevent them from going to the next level, which is diabetes. So there are a few pointers that we really need to be looking out for those of you that are not sure whether they are pre-diabetic. Okay, you need to be checking out your HbA1c. Okay, it should be within the range of 5.7 and 6.4. Okay, ask your doctor if you don't know what it is. Okay, you need to be looking at your fasting blood glucose. Okay, you need to be like in the range of 100 and 125. Okay, check that one out. And you also need to be looking at your BMI. That's a big one. For most of the population, your BMI, if it's greater than or equal to 25, then definitely you have to watch it. That's pre-diabetes. And for the Asians, usually like 23, equal or greater than 23. At that range, you have to really start, doing something, because
Go ahead.
Because studies have shown that if you do something about it, if you lose, your body weight, at least about 5 to 7% of your body weight, or increase your physical activity, that you might prevent diabetes or you might slow it down. So it's always better. You don't want to go to your doctor and get that diagnosis that you are non-diabetic, that you need to start taking insulin or you need to start taking metformin. You don't want that. So you rather do something before it's too late for you to get to that point, which is modify your behavior, modify your habit. I always tell people there's two reasons why we eat. Okay, either we are eating, the main reason is we are eating to keep us healthy, and the other one is, we are eating for pleasure. But what is happening, because of the way, most of the meal that we are eating is prepared, like it's prepared in such a way that it's so addictive now that we eat so much, more than that we need. And then what usually happens if we continue, that urge for you to eat so much and not watch what you eat. And once you stop eating to stay alive, if you are not careful before you know it, you're going to start eating medication to stay alive.
That's right.
And we don't want to get to that point.
You have brought up so many important things. I just need to kind of, underscore a few of them, if you don't mind, Victor. One is that their food is modified, and if you find yourself eating a huge bag of chips, those bags of chips are actually modified for you to not stop eating it. So if you're feeling bad about the fact that you just can't stop, don't be distressed about it, because the foods are modified for you to be addicted to it. You need help. You need intervention. You need not to buy that bag. There are things that are going on that in these classes that you will learn about that you're not supposed to know about, right? So we want you to be encouraged. We want you to seek the support of a professional team, and we have that ability to do that with the Rapha Wellness Center. I want to spend a few minutes talking about your successes, because I know I've heard from Jocelyn just the exciting things that are happening. I've heard from the team at Millennium the exciting things that are happening. Let's talk a little bit about that, because I think someone listening right now is saying, you know what, I need to be a part of something. I need to change my life, and I can't do it by myself. So why don't you tell us a story of maybe one of your patients that are in the diabetes prevention program. Well,
right now, and as Victor stated, and he always told me, Jocelyn, you're expecting way too much. But I'm like, listen, 5 to 7%. And that's what they ask us. But right now, I push the people that's in the class right now. I want them to lose anywhere from 10% to 20%. And we have a couple of people that, since they've been taking the program in this last this last session on Monday, we're averaging anywhere from 2 to 6 pounds a week.
Wow.
And a lot of it, I think, is one, the dedication. And one thing I do know is that when they feel as though, whoever you're working with, when they feel as though that they can trust you, then they're not going to let you down. And so that relationship building is very important. And I have learned that over the years, that once someone can trust you, then they are willing to do, and they trust the fact that you are actually concerned about their well-being. So I think that is our success, is that we're not doing it, and I understand money is important and finances. We're doing it because we really want to see our patients transition from one place to another, and I think that's what is going on here. So we are having really great success there.
I want to hear a story.
And then Anita, we got Anita. She's this patient of ours. I'm gonna say Anita C. Just to make sure I'm in HIPAA regulation. Anita C. She's doing very well. She has lost. She's down 300 and no, not down 300. 35. She lost 35 pounds since October, and
she was about.
She was about, I want to say 290. So she's down to 260,
she's over
255.
10%.
She's over 10%. And the thing about weight is that good weight to lose is 1 to 2 pounds a week. So if you're losing 1 to 2 pounds a week, throughout the year you can lose anywhere from 52 to 104 pounds a year. So slowly, and that's one thing we emphasize, because it's frustration when you're coming somewhere, you're giving your all, you do not see the result. So one thing that we have incorporated with Rapha Family Wellness Center is not only do we take your measurement, your weight, we take your measurements, because we want to make sure that we can show something. And typically, you do not lose weight quickly, you are losing the inches, and that's what we're doing. So it's overall. So we have a couple. Anita C.
You got to tell me, you know, as an instructor, what do you see? Like you see people week to week to week, and what are you seeing?
The biggest reward that I see is when you see the transformation of someone's body. When I look at, basically I'm getting better now, where I look at you, I can tell you how much you weigh, what you need to do. But one thing I learned as being an instructor is that everything doesn't work for everybody. So you have to look at a person in their own individuality and then design a program for them. And that is what we're doing on a day-to-day basis. So this class, I'm amazed at this class. We have a couple people. I think overall in my whole class, since I've been teaching in January and it's now March, everybody has lost anywhere from 7 to 15 pounds. Wow. And that is tremendously great, because I'm pushing, because really when you think about 5%, 7%, that's not even 10% what you came in. That's not even hitting 10 pounds, really. So depending on where you are. And I'm just pleased this orientation that we're having, and on Thursday, we're looking to do great things with that. So it's always more of a center of why you want to be healthy. So these classes are not the basic classes that you may find elsewhere, because we are just looking at every component to make sure that overall you're healthy. And
there's other pieces to this, and they say that you have to finding a buddy.
Yes.
It's another important piece to
and
this.
Relationships are being formed. That class, I'm just smiling so heavy because that class is hilarious. We have different personalities. And one thing, I just want to take a step back, because I want everyone to know that you have to go get a well visit. Well visits are majority, and correct me if I'm wrong, but I believe every provider, that's free. So it's not something that you do not, it's a charge for. So I always say, go get your well visit. That's where you get your blood work done. If you need a mammogram, prostate, whatever the screenings are, you can get them done at your well visit. So always keep that in mind.
So there's two things. You keep talking Medicare. Also Medicaid is another important insurance for many of our patients. Is this part of your fee schedule as well?
No.
Okay, so actually there's so much to talk about.
We have like 5 minutes.
Yeah, we have to come back again. But quickly, before I get to the Medicaid, because there are so many good things that Jocelyn is doing that she's not even talking about. Okay, in our in our classes, quickly, in our classes, she does something called gospel aerobics. You need to really, you need to see it, you need to be there. I mean, you really.
Actually, Rita named that class. Rita named that class because everywhere I went, it was gospel Christian music. And I was like, what am I? And we were at the farmer's market at ECFC. She said, call it gospel aerobics. So that is my signature class. It's gospel aerobics.
So there are so many things, but let me move on. Concerning the Medicaid, what is happening now, because we are providing it for I call them client. I don't like calling them patient.
Right, of course.
We're providing them for our client, but Dr. Francis Ilozue, Rapha Family Medicine is actually the one paying for it because there's no funding for it. Right. Nobody would pay for that. So she literally the one, making sure that these people are able to come to the class. Right. But for now, the only way we can get paid is through Medicare. Okay. If you don't have Medicare, then Dr. Francis is the one doing it.
And they'll work it out with you.
Actually, they're not even paying anything. Pretty much, yeah.
And another class that we're offering for the Medicaid patients, there's so many other dynamics with the transportation. We offer a lifestyle management course where that is during the day, so you can actually come and it's no charge for you to come. So that is another class.
You just need to get over there, right?
Yes, you just need to get over there.
And then I know that there's food. That's another important part. Why don't you tell us a little bit about that?
So currently the main issue with most of the people that are trying to lose weight, that complain that they can't afford the food. So now what we are trying to do, we have some sources. We are working with Millennium, and we are Urban Farm, to provide veggie. Free veggie for the patient, for the participants that are coming through the program. So now they don't have any reason to say that they can lose the weight because they can't get veggies. Right. But now so
Allison Dehoney and her veggie van is also providing some fruits and vegetables. You've got the fitness.
We need more of those veggies. We need more of that.
And eventually we're going to teach them how to cook it as well, because some people don't know how to cook it, so we're doing that as well. Goodness. Let me just give you the information because I know we're shutting down real quick. The phone numbers are 833-4019, and the other phone number is 650-4036. Those two numbers you can reach us at, and you will get a response. If you have to leave a message, please leave a message, and we will respond back to you.
Those phone numbers are very quickly 716-833-4019 and 716-650-4036. I'm going to say it again. 716-833-4019, 716-650-4036. This has been a fantastic show. You're right. I've got to have you back on again. This is Rita Hubbard-Robinson. This is Millennium Health Matters Radio Show. Thank you so much, Victor and Jocelyn. We'll see you back here soon. And to you listening and watching, we want to encourage you to check in with us this time, 7 o'clock, every Saturday, 7 o'clock, here on WFO Power 96.5. Thank you. Have a great day.